Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about appendicitis. The appendix is a little one-ended tube that's attached to the cecum of the large intestines. Sometimes it's called vermiform appendix, where vermiform means worm shape. So that should paint a pretty clear picture of what it looks like. And these add kind of cute little worm-like structures. Function is actually unknown, though some theorists suggest that it might be a safe house for a gut flora. And some evidences seems to suggest that it plays a part in the lymphatic and immune system. Other, arguably more cynical viewpoints think that it's just a useless vestigial organ from our ancestors. Whatever the case may be, the fact remains that it's pretty talented at getting inflamed and causing abdominal pain, a condition known as appendicitis. As much as 10% of the population develops appendicitis at some point, and it's the most common surgical emergency of the abdomen. Since the appendix is a hollow tube, the most common cause of inflammations is something getting stuck in, or obstructing the tube like a fecalith, which is a hard lump of fecal matter that finds its way into the lumen of the appendix and wedges itself there. It could also be other things, so like seeds that were digested or even pinworm infections, which are intestinal parasites. Another cause of the obstructions, especially in the children and adolescents, is a lymphoid follicle growth, also known as the lymphoid hyperplasia. Lymphoid follicles are dense collections of lymphocytes that get to their maximum size in their appendix during their adolescence. Also, when exposed to viral infections like adenovirus measles or even immunizations, that immune system ramps up in these follicles can grow as well. Whatever the cause of obstruction is now, the appendix is plugged up, right? Well, the intestinal lumen, including the appendix, is always creating mucus and fluids from its mucosa to keep pathogens from entering into the bloodstream and also keep the tissue moist. Even when it's plugged, the appendix just keeps secreting as usual. When this happens, foods and mucus builds up, which increases the pressure in the appendix. And just like when you fill up a water balloon, it gets bigger and physically pushes on the afferent visceral nerve fibers nearby, causing abdominal pain. Along with that, the flora and the bacteria in the gut are now trapped, right? And intestinal bacteria that are usually checked in the gut like E. coli and Bacteroides fragilis are now free to multiply. And this causes the immune system to call up white blood cells, and pus starts to accumulate in the appendix. These activations of the immune system can be seen in the lab as increase in serum white blood cell count. Patients might also develop a fever in response to the infection, which in combination with right lower quadrant abdominal pain. At the point roughly where the appendix is known as the McBurney's point, is a super important sign of the identifying appendix. Also, along with the fever, other classic symptoms include nausea and vomiting. Now, if that obstructions persist, the pressure in the appendix increases even more. At a certain point, as the pressure keeps going and it continues to swell up, it pushes and compresses the small blood vessels that supply the appendix with the blood and oxygen. Without the oxygen, the cells in the walls of the appendix become ischemic and eventually die. Since these cells were responsible for secreting mucus in keeping bacteria out. Now, the growing colony of bacteria can invade the wall of the appendix. As more cells die, the appendical wall becomes weaker and weaker. And for a small portion of the patient, it gets weaker to the point where the appendix ruptures. Rupture of an infected appendix allows the bacteria to escape the appendix and get into the peritoneum. Patients often experience peritonitis with the rebound tenderness, meaning pain when pressure is taken off. Again, around the McBurney's point. Patients also have some abdominal guarding.